If we haven't got Brittany, then I'll welcome Lynn to perhaps talk from Lynn's perspective. I can see she's back now as well. So certainly, as you know, Warrigal have been supportive of GANA, and we had a beautiful launch event of their membership earlier in the year. But this program with Bachelor or Masters in Nursing is also being supported by Warrigal and really trying to support that recruitment and retention through the pipeline rather than the kind of ad hoc approach that might be occurring. Nope, we've got nothing. I'll flick through the slides and then we might just go to the group chat. But Lynn, if you do come back, let us know. And so I think that this is similar to some of the cadetship approaches. Oh, here we go. I can hear someone.
Can you hear us?
We can.
Oh, hello everyone.
Welcome.
Thank you. Lucky Buddha's here, one of our CNEs. So we've actually got a little bit of a group of us here. I'm the team leader for the clinical education team at Warrigal. I have Buddha Ray, one of our clinical nurse educators, Dorothy Fields, one of our clinical nurse educators, and the lovely Brittany.
Oh, Brittany, hi.
Yeah, so we're just really excited to talk about our undergraduate nursing program at Warrigal, which Brittany is one of 90 undergraduates that we have with us at Warrigal. So it's a very popular program to be part of. This is open to our current staff, but we also have had, new students come into us and be recruited into this role. So essentially, we just align ourselves with what students are doing at uni, whether that be the Bachelor of Nursing or their Masters of Nursing. And so you can see there on the screen that we've got a generalised current role equivalent. So first year, really sitting at that care service employee role. Second year, once they've got their medication competencies and done that at uni, then we do they're really at a Cert 4 level. So if anyone knows aged care, they know that that's more of a team leader role, doing some simple wound care in the medication round. And by third year is aligning more with that endorsed general nurse role that we have here. And so looking more at doing some of the swabs as well as aseptic technique. So it's been very popular in really simplifying the knowledge that people are gaining while they're at university. We obviously pay some really good rates too, which is exciting, particularly now we've had our 15% pay increase. So see there our undergraduate rate of pay for a first year, they're coming in at $30.05 an hour. So it's more than our care service employee. So Warrigal is really recognising the skills and knowledge you're gaining while you're at university. And that takes people all the way up until upon graduation, whether you're actually guaranteed a position.
Oh, we've just lost your sound. We might start wrapping up. So start popping your questions into the chat so that we can make sure we can have a good discussion as well. I think it's great to see just this huge investment in this next generation, that this is what we really want. This is what we know that we need humans looking after humans. And what I'm seeing in the comments in these slides is similar to, what Elliot was talking about initially, and Hilary as well, about being able to apply theory into practice. We know that our nursing students are so thoroughly engaged. They love the hands-on stuff, and they also love having their heads in books, but tying the two together is often the challenge. And it's a challenge for the educators to make those match. And we often can't match up a clinical experience with what they're studying in the books at any given point in time. But these aged care experiences are so rich that anything that we're covering, they're more likely to be able to actually see and have a sense of the person as well as the issue. Beautiful about.
I know that Warrigal are also trying to facilitate the placements for these undergraduates within Warrigal, but at different care communities. So they're hoping that by providing those supportive placements as well as a supportive work environment, that they will be improving their recruitment and retention when the Bachelor of Nursing students graduate, and then they offer them a new graduate year with the gerontological nursing competency. So they're making full use of the CPOP and the GNCs, as well as their own strategies to have an impact across the Illawarra and ACT, I think, Tasha.
I think absolutely. But also what I'm seeing, I feel like across the sector is that people are recognizing that, yes, you can invest in your own staff and hopefully you keep them. But also if you invest in your own staff, then they might go to other sectors and that will benefit those other sectors as well. So, the rising tide raises all boats. And we really hope that we can see that across the sector, that we're not trying to keep everybody just within one organisation, but we're trying to raise this gerontological profile and skill set and knowledge across the whole sector, and not just residential aged care, but there's the majority of people in hospital are over the age of 65, and older people are everywhere, literally. It's just something that we have to do. We really have no choice. But here, this is the next generation talking about how fruitful that is as a career option.